Datathons is the way we operationalize our mission of democratizing innovation and knowledge discovery. And it's taking advantage of the expertise of the people who are immersed in the problems themselves. An event typically happens during a weekend. It is a very intense event. It commences with clinicians lining up, pitching their problems, explaining why those questions are relevant to them as clinicians, followed by the data scientists choosing what problems they would like to be involved in. And over the next 2 days, they work together in terms of defining the problem, understanding it better, trying to come up with a design of the study to be able to answer the question. And by the end of the weekend, most of the time they have some preliminary findings to answer the original question posed by the clinicians. The last 2 events that we've had were simultaneously held at MIT in Paris and in London. And most of the teams that participated in the Datathon are on track to submit a manuscript for publication. And we think that this is a very abbreviated way, an accelerated way of discovering knowledge through the databases. The idea of bringing together data scientists and clinicians sounds so easy, but that's the biggest obstacle. These groups are typically not used to working with each other. They speak different languages. They typically don't want to be pushed outside their comfort zone. And this has been the biggest obstacle in terms of pushing this approach forward. It is even harder to do in other countries, we've realized. Boston is a bit of an exception in terms of being more collaborative in the way we do things, but replicating this in other places has been very difficult for us. I also would like to talk about the other research that we do, which is building and designing health information systems for low and middle income countries. The focus of that is improving quality of care in underserved populations. And there we have much bigger issues, including the lack of access to clinicians, as well as the typically absence of digital information systems to document the process of care. And our group is also involved with SANA, which is a volunteer organization that is hosted at the Computer Science and Artificial Intelligence Laboratory at MIT. And the group consists of various disciplines coming together, representing clinical medicine, public health, engineering, computer science, as well as business. And the people are drawn together by a passion to improve the quality of care in low and middle income countries. And the idea is the same. You leverage the expertise of various disciplines to try to address the problems that plague global health.